Well, hi there. How can I assist you today?
Well, I went to the doctor earlier because I've been having some muscle and bone pain. He performed some lab tests from some blood samples that he took, and the results show that I have some low levels of some of my vitamins. But I was going to ask him some questions, but he just got up and left the room before I could ask him anything. So I'm wondering if you think you could help me with this problem.
Well, of course I can help you today. Did he give you any kind of medical advice or any kind of prescriptions before he left?
No, he didn't give me any advice or any prescriptions. He said something about like it could be treated with over-the-counter medicine or like a lifestyle change.
Well, to me it sounds like he was referring to a deficiency in one of your vitamins. So let's see today if we can figure out which one he was trying to talk about. But to do that, I'm going to ask you just a few questions to kind of determine. So how often do you get sun exposure, and do you stick to a strict vegetarian diet?
Well, I actually own a bowling alley, and I have to be there during all of the open hours. So I'm inside most of the day, and we're open about 12 hours a day. So by the time I get out, it's dark outside. And so I don't really get any sunlight exposure at all. Also, I'm a very strict vegetarian, and I do not eat anything that contains any type of animal product.
Okay, well, sounds to me like you have developed a vitamin D deficiency, and maybe as a result of that developed a calcium deficiency. And this could be what's causing some of that bone and muscle ache that you've been experiencing. There's several ways we can treat this before having to use medication. The first thing I would recommend is trying to get as much sun exposure as you can, and I know this is difficult with your job. It would be good to start with maybe 10 minutes, 3 or so times a week. So are you able to eat lunch maybe outside somewhere in the sunlight during the day?
Well, we actually do have some picnic tables outside my building that a lot of my employees eat at, so yeah, I could probably eat out there with them.
Perfect. Well, let's start there. The next thing I would recommend is trying to incorporate some dairy products into your diet. And I know that milk would not really go with your vegetarian diet because it's, obviously comes from
Right.
cows. There are some products on the market, such as almond milk or soy milk, that would be better for your diet because they're not derived from animals. I would recommend getting at least 6 cups of those a day. And since you're not, really able to get the sunlight exposure that they recommend, this would also be another good place to start. So what do you think about that? Would that be achievable for you?
Yeah, I think I could make a pretty good effort to do that.
Good. Well, let's try that for a month. If in a month your bone, muscle aches have not really subsided and they're still, like they were when we started this, we'll probably want to go ahead and start you on some kind of treatment to get this whole problem resolved.
Well, what could happen to me if it gets any worse?
Well, studies have shown that vitamin D deficiency has been linked in some serious conditions. For instance, it can be associated with higher obesity rates, increased chances of colds and flus or other infections. You can have decreased muscle power, Alzheimer's, and you could worsen your asthma if you actually had that before.
Oh my goodness, that sounds so scary. I do not want that to happen to me. So I'm going to try my very hardest to make all of the lifestyle changes that you suggested.
Well, good, I'm glad. Now, like I said, if your condition has not improved in a month, I would like for you to come back here and maybe we can talk through some suggestions and establish some kind of supplemental regimen to get you started on.
Okay, yeah, I think I could come back after I go to the doctor next month and have my levels checked.
Perfect. Well, we'll see you then.
Thank you.